Full mouth reconstruction, you call it. Give us a working definition of this extreme smile makeover type of patient.
Well, let me start first with very simple things. Not so simple, but when patient comes in with a better smile, they're asking for porcelain veneers. And in most cases, we can deliver. If the teeth are chipped, worn down slightly, stains, that's a perfect choice. We can give them brighter, whiter smile, and they will look amazing. But there's other cases where patient is a little older, and they're severe grinders, and teeth got shorter and shorter over time.
Okay.
In that case, we can talk about veneers, but there's a but. We want porcelain veneers to last, right? We want your smile to last.
Okay.
When you ask for porcelain veneers, let me give you an example in a different industry. Let's say you have a house, and the house is older, and you want to get a new door, new, beautiful, magnificent door. And we can do this, right? We can change the door, but the house still stays old. And that house still can crumble because there's a problem structurally,
Okay.
right? So very similar thing happening with the mouth. If your teeth are worn down and they're short and you're forcing your smile, yes, I can place you some veneers, but will they last? Probably not. In order for it to work for many years, for a long time, we need to go back to your youth, to the side of the teeth which they used to be, longer in the back. And that's where the key is. The function should take over. We need to build the proper frame in the mouth with a proper space. When there is space...
Or else they'll break again.
That's correct.
Okay.
So when the back is taken care of, then we can give you beautiful front teeth, which will last.
So you fix the way the teeth come together.
That's correct.
So that way the dentistry lasts.
That's correct.
Okay. And what do you call that?
Full mouth reconstruction.
Full mouth reconstruction. So no matter, and we've talked, so no matter how bad their teeth and gums are, the full mouth reconstruction is you could kind of rebuild a whole mouth.
Absolutely.
With a combination of maybe even implants in the back if they're missing, or porcelain veneers, or crown, or bridge, or whatever.
There are different
that
options.
That includes everything.
There are different options, but we definitely, at the end of the game, can give you great looking smile, which functions properly.